I noticed that my vocal cord started hurting and it felt like a piece of sand was kind of stuck there. I was pretty sure it was a node. This doctor walks in and he has 5 interns trailing behind him. I say, I have a node, and he said, have you had a cold lately? And I said, no. And he said, well, it's probably from the remnants of a cold. But I didn't have a cold. And he asks me, well, do you want me to scope you? I don't think anyone wants a tube with a camera put up your nose and then down the back of your throat. That is the diagnostic tool to see the node. So he's bringing the camera down, ready to be like, and there's nothing. But instead he was like, and there it is. All the interns had the biggest smirk on their faces. And I wanted to say, this is great. I hope you guys have learned something today at a young age, to listen to your patients. I overheard him talking to the students and him say, it could be papilloma. HPV? Is this because you're embarrassed? Being depressed about not being able to sing anymore? I haven't felt in the mood lately to put anything of consequence in my mouth. He said he wouldn't touch the node. It's right in the middle of my vocal cords. He sends me to vocal therapy. Vocal therapy was awful because it was a guy literally trying to teach me the vocal exercises that I had done for the last 15 years. After I left vocal therapy, I cried the whole way home thinking it was somehow my fault how I can't do my vocal exercises anymore. So I decide I gotta go for a second opinion. Dr. Song scoped me and was like, yep, that's a node. It's a tough one to do, but I can do it because I've got this new surgical tool that I invented. I was so excited. And I was excited because he was excited. The surgery went perfect. It was a little hard not to talk for 2 weeks, but I started healing great. I could get my voice to where it needed to go. For me, it wasn't until I took the Mestinon that my voice really returned to normal. He also said, by the way, they tested the node, totally benign, just a typical node, not HPV. Quick story, right before the surgery, my PCP had to sign off on it, so she calls me furious, which was confusing because I had to tell her what EDS was. I said, I'm so sorry, I didn't realize I had to come back to you. I had seen the specialist in your hospital and he told me he couldn't or wouldn't, I don't remember which, take out the node. So I went to someone who could. These doctors are there to help you. So don't let them minimize or diminish anything you're saying. You don't have to be aggressive, you just simply need to state the facts. Ask them to write the symptoms they dismissed in the chart, just in case anything happens. After that, it's time for a second opinion.